ma'am, are you okay? Yes, sir. What's up? Yeah, yeah. You're gonna be okay, all right? You're gonna be okay. You're gonna be okay.
Oh my God, it hurts so bad.
Yeah, just stay. Ma'am, don't grab it. It's yours? Yeah, just hang in there, hang in there, hang in there. Hang in there, hang in there, hang in there. Hang in there, hang in there.
Oh my God, they ran me over!
What medic number are you guys? What you medic? 31. 31? I'm not sure, ma'am. I have to make sure I ask her though.
Medic 31. She's gonna go to County Hospital.
County, yeah. Thank you.
Why does it feel new?
Okay, sir, I'm going to read the vehicle to you. Let me know if you're aware of it, yes or no. It's California Vehicle Code Section 21950A. It states a driver shall yield to pedestrian within any marked crosswalk or unmarked crosswalk at an intersection. Have you heard of that prior to today?
Yes, I have.
Okay. Do you agree with that code section?
Yes, I do.
There's a few more code sections I want to go over. California Vehicle Code Section 21950C, the driver of a vehicle approaching a pedestrian within any marked or unmarked crosswalk shall exercise all due care and shall reduce the speed of the vehicle or take any other action relating to the operation of the vehicle as necessary to safeguard the safety of the pedestrian. Were you made aware of that, or have you ever been aware of that prior to today?
Yes, I have.
Okay, and do you agree with that section?
Yes, I do.
Okay. Were you taught to always presume that someone is there when you're turning left or right?
Yes, that's why we give ourselves some time to look before turning.
Okay, so yes, you were always taught to always presume that someone is there when you're turning right, correct?
Correct.
So the same issue you believe the garbage truck has on the left side with that blind spot, you believe that exists on the right side of the truck as well, is that correct?
Yes.
Okay, and that blind spot is around the door area of the passenger side of the garbage truck. Is that correct?
Yes.
Do you know whether or not Miss Edwards was at the time the impact happened? Do you know if she was in the crosswalk at that time?
I can't say she was on the crosswalk because she's never seen her. She was never there.
Okay, is that you don't know, sir?
No, she was never on the crosswalk. I never seen her on the crosswalk.
If you did see Miss Edwards in the crosswalk, would you have avoided the collision? Would you have stopped? Go ahead.
I would stop.
Well, how about this? At this time, sitting here for today's deposition, do you have any criticism of Dr. Miller's diagnosis of CRPS?
Well, I'm looking to see his note. Well, I actually diagnosed CRPS in this case, so
I'm
why
aware.
would I? What's that?
I'm aware. That's why I'm asking.
Okay, I'm not looking, I'm looking to see. Okay, so it looks like he documented sufficiently to confer a diagnosis of CRPS at that time.
CRPS is a nervous system disorder, correct?
Correct.
CRPS causes the nervous system to constantly send pain signals to the brain, correct?
I guess loosely in a lay description, probably yes, but it's not exactly right.
If you want to provide more specification so that we can understand, please do.
Well, CRPS is a disorder where certainly the sympathetic nervous system, which is one part of the autonomic nervous system, becomes overactivated and then causes sympathetically mediated pain.
But you did diagnose Ms. Edwards with CRPS, correct?
That's correct.
Okay. Now, the next question is to degree of medical probability. Do you know what caused the CRPS if not for the garbage truck running over her foot?
No, I don't.
Okay. And then CRPS with individuals, is it not described as pain that they have? Am I understanding that incorrectly?
No, most have pain.
Okay. And do most have daily pain?
Most have daily pain.
Okay. And then this cold feeling sensation, is that something that other CRPS patients of yours have had or have experienced or complained of to you?
Yes.
Okay. And this shooting type pain, is that something that you've had your CRPS patients report to?
That's not as common, but I have had it reported.
Mhm. And this pressure type pain, is that also something?
Yeah, also not as common, but I've had it reported.
And then spasms, is that something that you've had patients report to you that have CRPS?
Yes.
And then sitting too long can exacerbate CRPS, yes?
Yes.
So what you observed in Miss Edwards is she altered her gait to avoid pain in her foot. Am I
That's what
understanding?
we called it. Yeah. I mean, some people call it a limp.
Miss Edwards indicated to you that walking exacerbates the CRPS, yes?
She did.
Is that something that's common in patients that you've seen with CRPS in the lower extremity?
Yes.
Got it. And I just wanted to make sure. I believe you indicated this last time. I just want to make sure. CRPS is not something that you can cure. Is that correct?
Correct.
Can CRPS lead people to have anxiety,
Yes.
depression,
Yes.
lack of motivation,
Yes.
issues with appetite?
Yes.
And then for treatment, we discussed it briefly in the first deposition. I'm going to try to do this quickly. And correct me if I'm wrong, or feel free to add if I'm missing something. But some of the treatments I've seen include physical therapy, psychiatric care, ketamine injections, as well as spinal cord stimulators. Is all that correct?
For some patients, yes.
Gabapentin, how does that help the CRPS?
It stabilizes the nervous system.
Okay, duloxetine,
Same in a different mechanism.
pregabalin, same thing.
The same as gabapentin.
Okay, and I think you indicated that Miss Edwards had 3 of the requirements for CRPS, but there was one she did not have.
Categories? Yes.
However, this page says requirement. Again, I don't like getting lost on lingo. Do you want to use category or requirement?
Well, no, requirements are 1, 2, 3, 4, and within category requirement 3, there are categories that
No,
are
no.
required.
How about this? The 4 requirements, did she hit all 4 of those or no?
Yes.
What's floral CRPS?
Florid, that's when you have all 4 categories and some of them are very dramatic.
So it's all 4. Is it all 4 of the categories within requirement 3 or just all 4 of the categories?
All 4 categories in requirement number 3, with several being dramatic.
So it's not just having all 4 met, but there are dramatic components to it?
Yes.
What's an example of a dramatic component?
You walk in the room and the patient cringes because the door opens and the allodynia is so severe on the top of their foot from the wind of the door that they cringe.
Okay. Are you aware that the defense had another orthopedic exam prior to your examination or no?
I have no knowledge.
Okay. Okay. If you don't know, that's okay. I'll make a representation to you. Are you aware that there is a defense medical exam by a defense orthopedic surgeon or no?
No.
Okay. And it's fair to say you've never spoken to that orthopedic surgeon. You don't even know who they are.
Correct.
To begin, your surgeon makes an incision. Next, instruments are used to remove the damaged cartilage from the joint surfaces. After the joint surfaces have been prepared, your surgeon will place the plate over the ankle joint. The anterior ankle fusion plate is anatomically designed to contour the shape of the joint. 2 temporary pins are used to hold the plate in place. Next, using a variety of instruments, your surgeon places screws into the plate, holding the bones of the ankle in position, allowing for bone fusion.